Thank you very much, Eileen. Jason Heck, who is now the Chief Staff Person for the 40th District, Senator Kevin Ranker. I will give you a brief description of Senator Ranker. He brings with him 15 years experience in community development and public policy to the Washington State Senate. Senator Ranker has worked at the local, national, and international level, developing and advancing coastal and ocean policy, community development strategies, and conservation initiatives. Before his election to the Senate, he served as a member of the San Juan County Board of County Commissioners. In the Washington State Senate, Ranker serves as the Vice Chair of the Agriculture and Rural Economic Development Committee, Vice Chair of the Natural Resources, Ocean and Recreation Committee, and a member of the Environment, Water, and Energy and Transportation Committees. In 2009, Senator Ranker was elected by his fellow legislators from throughout the country as chair of the National Coastal Caucus of State Legislators, a bipartisan group representing legislators from 29 coastal and Great Lakes states. He is also a member of the National Caucus of State Legislators, Environment Committee, and the Agricultural and Energy Committee. In the private sector, Ranker is a senior fellow with the Ocean Foundation, an international community foundation and think tank based out of Washington, D.C. In this role, Ranker advises the foundation and others on national ocean policy. He is an avid paddler, fisherman, swimmer, and surfer, and lives with his wife and daughter on the San Juan Island. Now we have Jason Heck, his chief staffer.
And the only staffer, actually. I'm going to ad-lib a little bit because actually there's some overlap between the statement that Kevin was going to have me deliver and what has already been said. So I'm going to attempt to not repeat what's already been said, but his statement. First off, I'd like to apologize for not being present tonight. I believe that affordable access to health care for all of our citizens is a key goal that we as a community need to accomplish. Secondly, I'd like to thank everyone who came here to discuss and educate themselves about healthcare reform. On the program, we have healthcare reform in Washington State, and while the healthcare reform that we've seen recently is federal, it falls on the state to actually implement all of the changes that are happening. So the state is the one that's going through all the provisions in the federal healthcare reform and attempted to implement that. And I wanted to give some of the numbers that Eileen mentioned that there are in terms of educating ourselves on what this healthcare reform actually will do for Washington citizens. And so I have some numbers that I felt were important. Healthcare reform will open access. Hello? Okay, I'd like to outline some of the benefits. Healthcare reform will open access to Medicaid for 400,000 newly eligible Washingtonians by expanding eligibility to non-elderly parents, childless adults, children, and pregnant women with income up to 133% of the federal poverty level. That's pretty substantial. Up to 450,000 Washingtonians will get tax credits to help make health insurance more affordable, which amounts to up to $7.4 billion in premium and cost-sharing tax credits to Washingtonians. 92,000 Washington small businesses will receive tax credits to help make coverage more affordable, which is notable because small businesses make over 77% of our employment here in Washington State, and yet under half of those businesses are able to provide health care for their employees and themselves. Starting this year, 600,000 young adults in Washington will be able to remain covered by their parents' insurance policy until age 26. Unfortunately, I'm 27. In addition, once health insurance exchanges are operational in 2014, 1 million Washingtonians under age 30 will have access to less costly, catastrophic-only health care. I think one that everyone already knows is the donut hole will be slowly shrinking over time, so I won't talk about that again. 800,000 Washingtonians who are uninsured and 360,000 Washingtonians who purchase health insurance through the individual market will have affordable health care options. And as many as 100,000 uninsured Washingtonians who have pre-existing conditions will have immediate access to affordable health care options, which again is an enormous step forward. So, as you know, and I know, as Senator Ranker knows, the battle for affordable health care has only begun. This is just a first step, as Eileen characterized it, a faltering first step perhaps, but it's up to us to, as she said, educate ourselves, and not only educate and know what we want, but also advocate. And that's the next step, where you have to take it to your neighbors, you have to take it to your family, and take it to your friends. And you do have to cross ideological aisles. While it's great for us to get in this room here and empower ourselves with knowledge and rejuvenate ourselves, we have to take it to the people who aren't the believers. And it's just notable that, as we all know, there are polls for everything, but there are still polls that show that there is a large overwhelming support for repeal of the federal healthcare legislation, which I think, given that that is a step forward, a repeal of that legislation is probably a step back. So while it's not everything that everyone wants, it's a positive step that will benefit hundreds of thousands of Washingtonians over the coming years. And so it's up to every person to take a step to make sure that people know the benefits of federal health care legislation and in future attempts to change that system. So thank you again for your time and your dedication to this critical issue.
Thank you very much, Jason. And right now we're going to collect questions for Chris Cover-Bowles and Eileen Shatusik. And we're going to have some more music by the Prawns.
I have pictures if anybody's interested.